guess we're going. It's a pleasure to be here and have the opportunity to share some of our recent research findings with other attendees at the Creatine Conference. This is only my second conference, so I feel like I'm a newbie, someone who's new to the process. But having been to the last Congress, it was very exciting and an opportunity to really hear state-of-the-art synopses and critiques of where we are now and where we as a field may want to go. So what I was very struck with at the last Creatine Congress is how relatively little work had been done in the studies of the brain. And in fact, there was an active, I would say, really quite helpful set of discussions about should these studies be done, if they were done, what had been learned by them, and where do we go next? And as a psychiatrist, it's always more fun to study things that you know a little bit about. So it's wonderful to have an opportunity to put a foot on the step that takes us maybe a little bit closer to seeing how creatine may have a role in different aspects of clinical medicine. We in particular have been impressed by the fact that mood and anxiety disorders seem to be particularly prevalent or particularly conjoint with using creatine as a self-treatment, largely for improving strength in athletes and maybe feeling less anxious, primarily in women that we study who are in their adolescence. More recently, over the last couple of years, we've been looking at PTSD, as well as drug use, is also providing an opportunity for individuals to self-treat those conditions, which are also certainly very prevalent, but also very morbid. And finally, most recently, I guess, our group has been very interested in how would creatine work in conjunction with other agents to come up with potentially better treatments for these sorts of disorders. Those are my sort of opening salvo, if you will. But I would note that we're going to have time to really look at what's known and not known about combination therapies. Any questions? Or just keep rolling? Just keep going. The second slide that I'm bringing is one that's almost prescient because it talks about the importance of funding for the research that we do. This has generically been true in the nutritional supplement field for a long time. I think it took the clinical psychiatry world a long time to think that indeed there may be some real costs associated with doing high quality research, as of course there always are. And in an era of great political uncertainty, it may be tricky yet to navigate between doing research and providing clinical care and keeping one's family together. So these are challenging times. The third slide I brought was sort of an outline of some of the things I do in conjunction with clinical research, listing some publications and patents that have been filed. And there's relatively little work that's been done looking at whether or not patents are going to be cost effective as one way to provide more different kinds of particularly collaborative treatments, but I think that's something that's worth seeing for sure. So where do you get the money to start up? This is actually, I think, a real challenge for all investigators of any level of age or experience. My wife and I were very grateful to have the opportunity to move to the University of Utah about 12 years ago. That was, has been, as far as we know, a very successful venture, giving us the opportunity to look at use of supplements in the Utah public population. It is true, I was not misspeaking. The plural of Utah folks is Utahns. I don't know why, but they've been very receptive to the idea that there are probably more behavioral disorders that we know that can be treated effectively with nutritional supplements. And the funding in our case came from the state, from the VA, Mental Illness Research Center, and from a program called USTAR, or Utah Science, Technology, and Research Initiative. And all of those ventures were really very generous, making it possible for us and our scanners to move. One of the things that you also learn really quickly as a brain imaging person is that it's going to cost a lot to get whatever data you get. So get it in one shot and get it right if you can. Okay. One more editorial about funding, and that is I've had the opportunity and the privilege to work with individuals who are scientists at large pharmaceutical companies, as well as individuals who basically bet the ranch on small molecules that they're very invested in. The large pharma folks have more than enough money to do imaging if they want to. They are concerned, when you talk to them as a group, that it won't be cost effective to do that. And so the Pfizers, the Lillys, the GSKs in the world tend to keep their money dry until a time when it's really very clear that there's a very specific piece of knowledge that can be gained using imaging. And the smaller companies, because they're so very focused usually on a small number of interventions, wait until they have enough money to do one imaging study that may make or break at least some financed research efforts. So they're very different cultures. They're great people in all cases. And I guess I just feel compelled to warn you about everything, but caveat emptor basically just talks about the fact that we file patents, we write papers, we don't pitch any particular product, although they may come. And basically everything that you'll hear in my talk is going to be about off-label indications particularly for creatine, since we're here at this conference, but also for other combinations of natural products. So by virtue of trade and graduate education, I'm what they call a spectroscopist. For a while, I developed a nickname as peri-spectroscopist, and wasn't sure I liked that so much. But there are now more physically oriented scientists who've decided that they too want to use spectroscopy as a research tool. We have two major flavors that we use in this work. One is for something called proton or hydrogen magnetic resonance spectroscopy. And this gives us the highest sensitivity you can have in a spectroscopy experiment. That leaves us with somewhere between 7 and 14 different metabolites that we can see clearly. And I will get you a more complete list of those metabolites that we do measure. It's funny looking stuff. I have to admit that that's the case. But we do get a good view of what we call creatine plus phosphocreatine. It's catchy, I know. But the signal arises from both of those parent molecules, and also the physiologic responses to different kinds of metabolic stressors comes from both molecules. Myoinositol is said to be very important for signaling using the myoinositol pathway. Glutamate and glutamine have come on in the last year or two to be taken forward as potential neuronal compounds by John Crystal and his group at Yale. And in our world, that's a very strange thing. Myoinositol is most commonly seen as an indicator of inflammation. Well, there's no problem that we have or issue that we have with studying inflammation. Indeed, a lot of the current research that is moving forward in the area of mood disorders does say that it is most likely that inflammation is playing a critical role in the changes that we'd like to characterize more effectively. So those are proton or hydrogen magnetic resonance spectroscopy studies. the other flavor, as soon as I figure out how to open the handout, is that phosphorus spectroscopy is a technique that can be used to study high energy phosphates in particular. And in our work, what we've typically found is that individuals with bipolar disorder demonstrate real derangements in their high energy phosphates, especially when one is looking for novel treatments. This offers an opportunity for earlier intervention and does, at least in our experience, put a number of findings that have been observed by many different investigators into a more coherent framework. And so at the bottom of page 9, creatine is thought to strongly influence mood and bioenergetic reserve. And we've been doing that for about 15 years. So I really am getting old. So sometimes treatments extend from the world of fancy storytelling to the world of real theories that have a more coherent thrust. And looking at this picture of myself when I was a little bit younger than I am now, one can see that changes in body habitus, something that weightlifters and movie actors actually get to demonstrate the effects of creatine in particular, but other compounds together with it, as being a really good opportunity for learning more about how the body responds. So that, of course, is not me. No one took that seriously. But Arnold Schwarzenegger is still around and doing remarkably well for a man who's up in his older years. Okay, so let's do some science and stop talking about politics and molecules and other imaging techniques in this Congress. But what we'd like to do in this talk, or I guess in this case, what I would like to do is to note that creatine serves as an energy buffer, and that phosphocreatine, once it's converted to creatine, can release a great deal of energy that can be used for any of a number of purposes in the form of ATP. And this is the role that's more generally ascribed to the creatine kinase reaction, where phosphocreatine can be used to convert creatine into ATP, which can then be used as energy. Where do you use that information, and how does it make some sense from a clinical perspective? Well, you've heard that creatine phosphate may be an energy buffer, but it seems that it is particularly important in mood and anxiety disorders, and more than that, particularly important to women as a potential treatment for mood and anxiety disorders. Men don't seem as inclined to have troubles that phosphocreatine will address, and that may be in part due to the fact that many men are already taking creatine or compounds that contain creatine. If you want to get fancy, which isn't, I think, quite where we are yet in terms of this discipline, one can combine creatine with omega-3 fatty acids or with acetylcholine as compounds that will give you, in our experience, a much stronger metabolic change that may have real therapeutic opportunities. And that's what we'd like to talk about today as well. So I have about 8 to 10 slides to show you studies that we've been involved with. I like to think they're good studies, but they do all show effects in any case. In an animal model that we developed for hypobaric hypoxia, Dr. Shmi Kanakar was able to demonstrate that some antidepressants were much more likely to be effective in treating refractory depression than others. And this is something that we also attribute to changes in cerebral metabolism related to refractory mood disorders. But it's certainly something one can see without working too hard. That would be a behavioral study. A spectroscopy study is one that was undertaken by Dan Iosifescu, who's been involved with the program here and who has a really excellent research program at the Nathan Klein Hospital. And what Dan and his colleagues have found is that they can characterize the treatment-resistant depression with something like 80 to 90% sensitivity and specificity, which is for treatment with a natural product pretty remarkable. In and of itself, one could use this as a biomarker, and there are some companies that believe that biomarkers are going to win the day in terms of providing an opportunity to learn more about when things are going well or going wrong, particularly with compounds that might have real metabolic enhancement effects. So Dan has done a couple of studies now looking at the effects of, in particular, creatine intervention in individuals with refractory depression, and they've turned out quite well. Turning the page, we can also see that In-Kyu Liu, who was a fellow in our group many years ago now, well, he may deny that that's the case, but we think it's true, before he had to go back to South Korea, was able to nicely demonstrate changes in phosphocreatine and beta nucleoside triphosphate just in healthy men. The study worked quite well and served as a basis for a couple of clinical trials that we segued into. We were able to use Dr. Conacar's data to pick the SSRI of choice, which we think is an important aspect of this work. Left to one's own devices, one could pick seemingly any of a number of SSRI antidepressants, but armed with data from animal studies, one can be a little bit more selective in identifying the types of compounds that might be studied next. You can see in the bottom of page 9 that SSRI augmentation with adult females resulted in quite marked antidepressant effects. It was a study that was done by Dr. Yu after he went back to South Korea. And what he found was that women who were being treated with either placebo or creatine had a very robust response to the creatine, but not to the placebo. And that's pretty unusual. Robust responses are not the kinds of things you imagine will be seen in response to clinical trials, but in this case it was true and very striking, at least striking enough for us to continue doing work in this area. Moving from adults to children, what we found is basically the same thing. In this case, we had a little more funding, which was great, and we were able to look at dose response curves to creatine in our cohort of adolescent young women who had come in for a treatment study. And they said, yeah, creatine will work quite well if the dose is high enough. And so the dose that was used was 6 grams a day, I believe, in the study put together by Dr. Doug Kondo, who's been investigating pediatric mood disorders for a long time. So what else is there to say about this? Other compounds that we thought might be worth testing arose from the fact that mood and anxiety disorders are really very prevalent in populations that are SSRI deprived. So we decided to look at the comparative effects of creatine as well as PTSD, and found that the effects were almost identical, that PTSD is treated very well, as are other anxiety disorders that we've been able to study. This has been of interest to our collaborators at the VA, where post-traumatic responses vary a great deal, and where existing treatments leave something to be desired for many participants. That was creatine and placebo as one combination. Creatine and placebo as one combination we'd like to do more work on. And we've also done quite a bit of work with stimulant users that very elite professional athletes often feel that they need to become more competitive by using stimulants. And so that's what they do. And what has been noted there is both for men and women, at least a 50% reduction in symptoms of depression or anxiety, which is an almost off the charts kind of response. We are in the process of replicating that now because it's such a robust and surprising outcome. We think that there's a lot to be learned by continuing that study, that line of research. Moving ahead, just a little bit. We want to know in particular our history of work with natural products started off with studies of acetylcholine when Dick Wertman was very active in this field. And it's really a remarkable supplement, not as a source of choline per se, but really as one that can increase levels of dopamine and serotonin pretty nicely just on its own, which avoids a lot of side effects related to treatment and or the mood or anxiety disorder that one is presenting for. It's the structure of acetylcholine presented at the bottom of page 12, and the structure is not really anything remarkable, although the ability of Kyowa Hakko in Japan to produce large amounts of very pure CDP choline is extraordinary. So what does acetylcholine do if it's, really the be-all and the end-all? Well, it does a couple of things. One is it clearly speeds up phospholipid synthesis in the brain, which is very useful because depending on the fatty acids that you incorporate in your phospholipids, you will have a better or a worse response to treatment and the synthesis of brain lipids. The other thing that was very striking was, as also seen in major depression, we get reductions in brain beta NTP levels that occur about 6 weeks after treatment starts with a conventional antidepressant. And that is also a pretty robust response. We're not used to seeing these at all, let alone across a number of different animal models. So acetylcholine, also very useful for the synthesis of phospholipid in the brain, but probably showing more of a stimulant-like pattern of activation in studies of healthy normal subjects. Omega-3 fatty acids. The audience here should be able to tell me much more than I know about omega-3 fatty acids, but there are some strong interactions between the omega-3 fatty acids and mitochondrial function. Again, we think that mitochondrial dysfunction likely plays a critical role in mediating the anti-inflammatory effects of acetylcholine. And so we did some more work. In this case, this being page 14, looking at the antidepressant effects of uridine and omega-3 fatty acids taken together. And at least in our lab for this one study, this combination of ingredients had a remarkable, robust pro-mitochondrial effect. And it's certainly something that should be studied more. One possibility is that what we're studying is the effects of metabolic enhancers that haven't really been well characterized. And they're certainly open to that as one possible explanation for our results. We also think that basically the tissue's metabolic content is strongly influenced, and so that the effects of uridine and omega-3 fatty acids are quite similar to those that are seen with CDP choline and omega-3 fatty acids. Supplementation with omega-3 fatty acids increases the rate and the depth of an individual's response to treatment with that combination for reducing mood and anxiety disorders. Again, a similar sort of pattern that we see. Despite what we might be administering, we find serotonin seems to be enhanced and dopamine also increased. But in the case of dopamine, probably more of a pro-stimulant effect. Finally, no, not finally, but almost finally, you're almost done, I guess, for the day. Omega-3 fatty acid treatment in bipolar disorder has been of great interest for us. And that combination is one that we've recently been using. And it really does seem to lead to behavioral effects that are consistent and robust. So that's what we're looking at. Yes. One of the things that that I learned in graduate school was that it's fine to have neurotransmitters, but you also have to have proteins and lipids to mediate the effect of any compound that you hope will go through or settle onto a plasma membrane. And we found that in particular, this combination of treatments works better in individuals who have not elevated, not decreased, but normal tissue cholesterol levels. And this seems to be almost essential for getting a robust response of any kind. And so as we push to take full advantage of the benefits that statins afford one, there's a lot to be said for cholesterol as a single agent and in combination with the other compounds that we've been talking about. We were able to find a number of really quite good explanations for how this might be happening in the well-known Wikipedia resource for all things. But this combination of cholesterol in addition to serotonin and efficient high-energy phosphates, at least in our hands, gives us a strong response. Just as a note, last year has been the year of ketamine and it's in mood and anxiety disorder psychiatry. So it's interesting to note that one can also see changes and increases in ketamine and glutamatergic markers when there's been a lot of turnover of glutamine-containing compounds. And we think this is maybe one way to begin to explain why the responses to ketamine in terms of glutamatergic activity dependence have been so strong. So that's a little bit about where we've gotten with this. Where are we going? We think there's a lot to be said for effective and cost-effective molecularly active compounds, particularly for individuals who struggle to meet ends meet and to have efficacious treatments. We're not the only group that's working in this area. Since the last Creatine Congress, there have been a number of laboratories that have picked up the charge, and we look forward to nothing quite as much as the next Creatine Congress, where we hope to finally have someone wise explain this all to us. I'm happy to take any questions you might have. Thank you so very much.